An estimated date of discharge is an estimate of the time that the patient is in the hospital.
It's a method of keeping the patients informed, as well as it gives a timeline for the team to work with. And it's based on data to determine an average length of stay for that particular condition.
The team leads and the nursing team, the physio and OT, we all work together on bullet rounds to pick an EDD.
The estimated date of discharge, I guess you could say it's a rolling number, so it can be updated daily.
We have to be flexible, and if patient's condition changes, then we will push back the EDD based on what the next treatment plan may be.
And there may be some new barriers present, such as getting equipment into the home in time, setting up services that they may need.
Also on the other side, if we're expecting that someone's going to be going home on Thursday and physio says that they're doing better than expected, they can go home Tuesday. So it's all a very fluid thing.
I find it's important for patient flow because this person's going to be leaving soon. What do we need to do to get them ready to get out of here? Because ultimately that's their goal.
If they need to go for a CT before they leave, we can really push to get that CT done before that date of discharge arrives.
It's helping us to organize their discharges. The better we can make the flow of the patients through our emergency departments, their admissions, and then their discharges, everything works better.
It's very important for the family to know the estimated date of discharge so they can be just as ready as the nursing staff are.
Sometimes being in the hospital helps families prepare for learning the work of taking care of their loved one at home. So they get the hands-on with the nurses, they understand the goal, they work towards that together.
And on discharge, I go over everything with them, and you can tell that they really are appreciative of all that.
I don't know how many times before SafeRef started that we would call up a family member and say, hey, this is what's going on, and they'd have no idea, and then we'd have to work around that.
We have a deadline and we're checking in on them either every day of the week or at bullet rounds 3 times a week. Then we're really making sure that their days in the hospital are valuable, are useful for their care, tasks are getting done, and we're heading to that goal.